Let's now discuss the second part of pathology of liver imbalances as we continue with diagnosis according to Zhang organ patterns. In general, symptoms and signs that have a close relationship with the menstrual cycle can indicate that there is a liver imbalance. Whereas liver excess symptoms typically manifest in the premenstrual period, liver blood deficiency and liver deficiency signs and symptoms can be more pronounced immediately after or towards the end of menstrual bleeding. The liver has a significant influence on the menstrual cycle. This is due to the liver's close relationship with the movement of qi and blood, and because the liver is a reservoir for blood and supplies the chongmai with blood, thereby enabling menstrual bleeding. If there is liver blood deficiency, there can be too little blood to create menstrual bleeding. This will result in either amenorrhea, scanty menstrual bleeding, or a long menstrual cycle. The cycle can also be longer when there is a stagnation of liver blood. In these cases, the stagnation of blood will not only delay the menstrual bleeding, but also the menstruation will be painful with a sharp, stabbing pain that is constant and fixed in its location. The menstrual blood will be dark and clotted, and the passing of clots will often ameliorate the pain. Dysmenorrhea can also be a manifestation of liver qi stagnation. In these cases, the pain will be more spasmodic and cramping in nature. The cycle can be irregular when there is liver qi stagnation. This is due to qi and blood not flowing smoothly and rhythmically. The stagnation of qi in the liver channel can result in the breast being tender or swollen. Mood swings in the premenstrual period are another classic sign of liver qi stagnation, especially if the woman is more irritable than normal. Liver blood deficiency can manifest with a woman being weepy and sensitive during this period. The stagnation of liver qi in the premenstrual period can also disrupt the functioning of the spleen and the stomach. This means that there can be abdominal bloating, irregular or loose stools, edema, and an increased craving for sweets during the premenstrual phase. Stagnated liver qi can become rebellious and invade the organ in the middle jaw, disrupting the qi dynamic. If the liver qi is stagnated, or if the stomach and or spleen qi is weak, the liver can invade these organs. This will lead to symptoms such as abdominal pain or bloating, alternating constipation and loose stools, or belching. Liver fire can invade the lung, resulting in cough with yellowish or bloody sputum, dyspnea, and chest oppression. Bloating, distension, and pressure are some of the main characteristics of liver qi stagnation. When qi stagnates, it creates a greater tension or pressure in the area. This can give a sensation of being distended or bloated, and it is this sensation that is critical, not whether there is actual physical bloating. If the area is bloated or swollen, this will be just a confirmation that there is a stagnation of qi in the area. As well as disrupting the middle jaw, liver qi stagnation can cause costal pain or chest oppression, where there will be a sensation of the chest being bound by a strong elastic or a metal rim. The stagnation of qi in the upper jaw can result in difficulty with breathing deeply. The liver is physically located just below the costal margin. The liver and gallbladder channels traverse this area. This means that when liver qi stagnates, there can be tension in the hypochondriac region. This is interesting because it is a defining sign of liver qi stagnation in Chinese medicine textbooks. However, not many Western patients report it. If, on the other hand, you ask Western patients whether they have tension in the diaphragm and the solar plexus, they will often say yes when there is liver qi stagnation. Liver qi stagnation will often, over time, generate heat in the liver. This can ultimately lead to liver fire, but in milder cases, it will just result in emergence of heat signs such as thirst, a rapid pulse, red sides of the tongue, irritability, and so on. Thank you for your attention.